Good afternoon. Welcome to my broadcast. I hope you've all had a good Easter and a good break. I'd like to start by paying tribute to a number of personnel who both serving and retired from the service who've died in the last 10 days. Mark Stockton and Stevie Kerridge, both serving members of staff, have passed away and their funerals were this week. Sandy Sangster, Russell Hamilton, Willie Clark, and of course, Derek Wilkie, all retired and have also passed in the last 10 days. And I know that you've joined with the whole organisation in this past 10 days to pay tribute to all of those people and send your good wishes to their family and their friends as you've posed for pictures outside the stations. We paraded and we did that today. Stevie Kerridge's funeral was at 11 o'clock today. We did that here on the drill square with the recruits, just to demonstrate that whilst we can't be with these people, we can't have a service funeral, we can't stand with their families, we're actually thinking of them and sending our very best wishes and condolences to them and also the friends who knew these people. I'd also like to pay tribute to a number of people who have celebrated some milestones this week. So we have Joe Harkins, who is, well, he's retiring after 40 years as the chair of the Retired Employees Association. That's at the end of this month. Thank you all for all the work that you've done for that, Joe. Marie Bell has served 30 years in the service, working. She currently works for John Dickey, ACO John Dickey. Well done, Marie, on those 30 years. And she had a small celebration yesterday by Skype. And then Joe Mackay, who was 50 years young yesterday. So very happy birthday to Joe. Still haven't seen the cakes. And I think there's some unsung heroes that we forget about because they do a really brilliant job and just get on with the job that they're supposed to be doing. And they're the people that make sure that our appliances are on the run, our appliances are crewed, and that's central staffing, Heather Watson and Gary Nairns. Well done for you and your support assistants across the whole of the country for the work that you're doing. I know you've been working remotely for some time now and making sure that we have enough people in the right slots at the right time to keep our appliances on the run. And as we've seen over this last 40 odd days, we've got appliance availability as high as we've ever had it. And we've got 115 of the 116 whole-time appliances on run and 320 of the 345 retained and volunteer appliances. So well done, everyone, for the work that you're doing. And I'll touch on this later when I talk about positive innovation, but we've had some significant fires over the last couple of weeks since I did my last broadcast. And we've responded to them in the way that I would expect you to respond every single day that we get a fire call, a really professional, efficient and effective manner. We've had some very hard-working wildfires, particularly this week, from last week, actually last Friday onwards. And there's been some really excellent stops where property has been saved by the intervention of fire crews. So well done working in quite arduous circumstances and working very hard. And we've currently got a level 3 wildfire running at the moment, has been running since yesterday. So thank you for the work that you're doing. Thank you for the efforts that you're putting in. Thank you for turning up and doing a great job. Clearly, 2 weeks ago, we were looking at the end of the first period of lockdown. And whilst we all expected the First Minister to announce that there would be a further period of lockdown, I think it always comes as a slight surprise and a slight disappointment that we can't get out, we can't see family and friends, and we can't do what we want and go where we wanted to go. I think as we've seen, the results of the last 3 weeks lockdown, we're now in week 4 of lockdown, have meant that the infection rate is now below 1. So one person becoming infected, less than one person is being infected, other person is being infected, and that's just brilliant. And it's difficult to do. I had to have some self-isolation this week. I was displaying COVID-like symptoms earlier on in the week, so I self-isolated with my whole family. And just 4 days was quite enough. I think that's what my wife said as well. 4 days was quite enough, me being at home. I should be getting back to work. But actually, what I experienced was the wonderful support that we have through our HR team and the access to the testing that we've had for over 3 weeks now, where we can go and when I drove to Glasgow Airport, the testing, the registering procedure was very straightforward. The testing procedure was very, very straightforward. It only took a couple of minutes from the time I drove in to the time I drove out. And then I got the results yesterday, tea time, to say that my test was negative, which I'm delighted with. So what we're seeing across the whole of the country is we're seeing about 3% absence rates due to COVID, and we are making sure that we offer tests to members of staff who then start to self-isolate. And you'll see from the notifications from Her Majesty's Government, also from the Scottish Government, that testing is available for whole families now. So if someone's self-isolating because a member of the family is displaying COVID symptoms, then the whole family can be tested. But for those who are at home working, who are balancing and juggling children and work, thank you for what you're doing. We've talked before, and I've talked before, and there's information on our website about making sure that you look after yourself, because that's actually the most important thing. Your own physical, mental and emotional well-being. Everything else follows after that. If yours is a bit rough around the edges like mine was earlier on in this week, then you need to look after that. Please pay some attention to that. Please look after yourself. Please look after your family. And then comes work and making sure that we then do the work that we're asking you to do. And what I'm seeing is as a service, we've transitioned significantly over the last 4.5, 5 weeks. So the lockdown was announced on March the 11th, and we've moved such a long way in such a short period of time, in that we are managing our response to COVID really, really well across the whole country. We're making sure we've got support in place at a local level, and I really appreciate the people that are working locally, looking after the vulnerable, whether it's medicine deliveries, it's food box deliveries, providing fire cover. Just, it's brilliant to see the stories coming through of the work that you are all doing to make sure that we pull together as a country in our response to COVID. And it's just excellent to witness the work that's going on in the organisation. It hasn't stopped. Whilst we've slowed down slightly and we're not doing some of our business as usual, we're doing a lot of work still. And people are busy at home, whether it's procurement, whether it's finance, whether it's IT, whether it's our officers, whether it's our admin support. People are pulling out the stops and doing the best they can possibly do. I really do appreciate that. Thank you for everything you're doing. And we are looking at least another 2 weeks. So please continue to look after yourselves. Please continue to follow the guidance. If you've been on iHub recently, you'll know that there's additional guidance there around at-home working, some things that you can think of doing. There's also some additional guidance around health and well-being. That's some really good guidance that Liz Barnes and her team have pulled together, making sure that there's resources on there that are relevant and easy to understand, easy to use, that you can then dip into, and you can start looking after your own personal resilience, as well as dealing with any issues that you may have. I think it's one of those interesting things for you coming in today, listening to the news, that whilst the retail sector has dropped significantly, I think it's about 5% retail sales have dropped. Food sales have gone up by about 30%, as have alcohol sales. And so there's a challenge for all of us, I think. In fact, we know there's a challenge for all of us about overeating and over drinking and making sure we're keeping ourselves fit. So getting out and doing exercise. And there's information being provided by the health and wellbeing team about things that you can do to keep your body moving, so that we don't become couch sloths and then have loads of issues to deal with when we come out of it. You know, I've heard the joke about whether we should go to Alcoholics Anonymous or Weight Watchers when we come out of this, or maybe we should do both. Well, actually, I think it should be our ambition to come out of this relatively fit, and maybe having learned a new skill and telling each other about the new skill. So I'm doing juggling, and so I may do a video juggling. I may share that with you at some stage. At least you can have a good laugh. But I'd encourage you to share stories of the things that you're doing whilst we're in this lockdown. What are you doing to keep yourself engaged? What are you doing with your teams? What are you doing with your families? You'll know that Comms put out a very, very hard quiz a couple of weeks ago. Well, if you're doing that with your team, please share them, because we'd all like to see them. It'd be really excellent. So I talked a little bit about health and wellbeing. They had the new health and wellbeing group had their first meeting this week, and they're looking at what resources and information can be put in place, and particularly looking around advice around debt, and advice around weight management, and also advice around alcohol. These are the things that are actually quite important. Actually, we're seeing the biggest referrals into our services, so we're making sure those resources are available for you. And I'd encourage you to look at the resources that are available on iHub and just tap into them. And if there's something missing that you'd like, then please let us know through the comms email address, and we'll look at that and we'll feed that into Liz Barnes and her group. I talked 2 weeks ago about a launch of our internal Facebook group. Next week, we're going to launch individual employee networks, whether it's within your team, whether it's a protected characteristic, whether it's a station, whatever interest you share, you can have an employee network of your own. I think what we're trying to do is enable people across the whole of the organization to have a voice. Wherever you are in the country, if you've got a view about something, you can feed that view in, and you know that it will be listened to, you know that your comments will be read. That's one of the things that I've been talking with my strategic leadership team about over the course of the last 3 or 4 months, is how do we create an employee voice for the whole organization? So not just for uniformed staff, not just for staff that are in a union, not just for staff that are support staff, but for the whole of the organization. What do we do to engage effectively so that as an organization we have really good two-way dialogue between myself and my directors and yourself, so that we can exchange ideas on how we're doing things? I think for me, that's the only way we'll take this organization forward effectively and properly, is to enable that dialogue. And it's not an easy problem, because we are a very large organization over a huge geographically dispersed area, but we are going to work at this. And that's one of the things that through the survey around the comms that Marisha Waters did earlier on last year, that's one of the things that came out, actually, about how people can contribute to the direction of the organization and feel part of the organization. So last night was a Clap for Carers night. So I've been really encouraged by the way that we've supported that. You'll know that we put a communication out on Wednesday to say that there shouldn't be unnecessary blue light journeys. We've been working with Police Scotland around that. It had seemed to become, not just in Scotland, but across the whole of the UK, a bit of a competition to see who could do the biggest and the best and the loudest and the brightest. And actually, I think that's missing the point. This is about people standing outside their doors and clapping across the whole of the country. It doesn't need to be seen by everyone, but the NHS know that we're doing that. So we've stopped that. We've stopped the unnecessary journeys. I think the thing that really struck home was looking at Westminster Bridge last week and seeing the huge numbers of people on Westminster Bridge, no social distancing. And there is an irony in that, isn't there, that we're out clapping for the NHS with no social distancing, when that's one of the things we should be doing. So you've been sending in your videos, and I really appreciate you sending in your videos. Please, will you continue to do that? Send them into the media team mailbox, and we're going to collate them and do a montage of them so we can see what's been going on, whether it's a fiddle player, the violins. We had a violinist in our street last night, whether it's bagpipes, whether it's someone doing a Highland jig. Please, we'd like to see all of those videos and how you're clapping for carers. And this week you'll have also seen, no doubt, on the news that we had our training at the NHS Louisa Jordan. So that's the Scottish Nightingale Hospital that's based in Glasgow, and we had York Hill Red Watch training with the NHS. So they enacted a small fire within the hospital, and we used the task cards, or the attending crews used the task cards to correctly follow the donning procedure for tackling a fire in a COVID-19 hospital, and successfully extinguished the fire. Good communication between operations control, the attending crews and the NHS, and then using the task cards correctly did the correct doffing procedure as well, making sure that actually we followed all the procedures. So that was really excellent to see. That was captured well, and we had great coverage on the STV News and across all of our social media channels. And it was great to see Red Watch dealing with the incident as you'd expect, professionally, efficiently, expertly, and with a good deal of humour in the process, even though it's a very serious situation. Clearly, we hope that hospital is never used, but we know that it's there if it should be used. So just looking through the things that we need to talk about, I've got a couple of questions, and I'm going to go on to some questions I've been asked. So we're reviewing this broadcast. We seem to be in a very good place as an organisation, as a service, in that we're in a very good rhythm now in the way that we're responding to COVID-19, and we're also undertaking some sort of business as usual activity. I know it feels a bit strange because we're sort of locked down, we're not doing unnecessary journeys, but we're actually operating in a very efficient and very effective way. What I want to make these broadcasts about is something that's relevant. So we're looking at the content, the style, and the frequency of these broadcasts. So on iHub is a very short survey about what you'd like to see as part of these broadcasts, because what we've seen over the last 4 or 5 weeks is, and I'm actually very encouraged by it, the number of questions reducing significantly, which means we're actually providing the answers and the information out there. And that's the idea. We're providing a framework for managers at a local level to make decisions and actually do things at a local level. So national framework, and I talked about this a couple of weeks ago, national direction, but allowing local managers to interpret where they can interpret. So please fill in the questionnaire, be really honest about it. What I want to make these about is something that actually scratches the itch that you have, gets the information that you want to you, and so that we have a really useful interaction. And I've got a couple of questions that came in prior to broadcast, and I can see some questions appearing on my screen. So the first question I've got is, if we have extra personnel, can we send them home like we do for public holidays so we can minimise the spread at risk of COVID? I have 11 personnel on today, and I usually run with 9 at a multi-pump special station. As we're trying to keep 2-metre distance apart, it's easier and safer with fewer personnel on duty. So no, not at the moment. And we're constantly reviewing our staffing model, and this is one of the issues that we've raised to consider. And we'll be looking to review the efficiency of that particular model over the coming weeks and amend the process as we go. I think what we're trying to do this in a measured and managed way. At the end of the lockdown, COVID-19 is not going to have disappeared. So if you've listened to any of the First Minister's broadcasts over over the course of this week, really, we're going to be living with COVID-19 for quite some considerable time. So actually our response and recovery may be running alongside each other for quite a long time. So we're trying to do things that make sure our staff are here when we need them. We've got about, as I said earlier, 3% staff absent. So we're continuing to review it, and we'll continue to review it through both the Tactical Action Group and also through Gold. Excuse me one moment. Second question, given that staff work in the same building, cook out of the same kitchen, etc., can gyms not be used but ensure strict cleaning and hygiene is followed? I absolutely get this. I really, really do. You want to use the gyms. I'd love to use the gym here at headquarters. The World Health Organization guidelines are that gyms cannot be used. So this is one of the areas where we're not having local interpretation. We are doing what's being guided by the WHO, and that's not about, and I've said this before and I'll say it again, it's not about what you touch. It's about, because it's cardiovascular exercise we're doing, it's about what is coming out of our lungs in fine mist, fine droplet form. So World Health Organization is no, and that's our guidance as well. Right, before I go on to the rest of the questions, I want to share with you a short presentation, and hopefully you'll see this now. Just talking about positivity and innovation. I think this is really important that we see what we're doing across the whole of the country, and just sort of enjoy seeing people. So a couple of operations control staff who've returned to Bolster. It's really good. I think we've had 6 people return to OC. It might be a few more than that. I'm sorry if I got the figures wrong, but it's great to see people come back and make sure that we've got enough people in operations control. So welcome back. Thank you for coming back. So David Geraghty and his wife Jennifer have been cooking as part of Resilient Communities. It's great in Eyemouth, and it's good to see that I think they're doing it 4 hours. I think it's 4 hours a week, and they get loads of food and they cook it up for the local community. So I think we'll make sure that we use their services at some stage. This was amazing. We talked a couple of weeks ago about PPE, disposable PPE going across the whole of the country, and actually we all know that Orkney and Shetland is such a very long way away. Well, we got disposable PPE to the fire station in Orkney and Shetland in 24 hours, and it was like planes, trains and automobiles. Driving, train, ferry, island hopping plane, and it was incredible. So thank you to everybody and partners, particularly around the ferries and the island hopping planes, in loading our PPE really quickly. And it's great to see everyone coming together and making sure that everyone has the right PPE. this was great, and this was again picked up on the news. Paisley Blue watched making a birthday wish come true for a 5-year-old, and this example has been a number of things across the whole of the country where stations have done special things for children who find it really difficult and are struggling with a lockdown. So great innovation, great positivity. Scott Gibson's he trains a female football team, and he's been keeping them fighting fit during lockdown. And I think you'll have seen the toilet roll keep you uppy challenge that they did was really impressive. And I've seen some retained stations do pass the pager as well. Although I did see one pager drop the floor and I heard IT gasp. I'm sure I heard IT gasp. But anyway, it was great to see these sort of things happening across the whole of the service. And then Paul Taylor has postponed his retirement. Really appreciate that. I'm not sure he's wishing to move to Spain just at the moment, but we're delighted that he's staying. We're delighted that he's keeping the pump on the run and using all of his experience to keep the community safe. And again, that was picked up as on STV News as well, which is great. And then I talked earlier on about the level 3 wildfire that we got running, and we've had quite a significant number of wildfires running over the last 10 days or so. So thank you very much for all of the excellent work that you're doing. Please keep on sending in information about what you're doing at a local level. So I'm going to move to the questions that I've been asked. I will, if I had, you'll know that I had fat fingers a few weeks ago. It would appear I've got fat fingers again. Here we go. That's great. So my first question: you stated in a previous broadcast that the RDS should only be going into a station to respond to fire calls. Although I understand the sentiment, as I too want to thank the NHS and clap on a Thursday, surely the photos and videos being shared on social media are going against instructions of not going into station other than to respond to fire calls. If this is not being adhered to, then I would like to think drill nights can be reinstated. So I understand the sentiment. We've reviewed that, and there'll be further guidance coming out next week around station commanders and LSO teams at a local level making the determination around RDS drill nights. There are a number of ways to do this, and you can. I hope you understand why we made that distinction in the first place, and we are reviewing it, and we review it on a regular basis, and further guidance will be coming out next week for that. RDS and volunteers reporting to emergency call response must have adequate business car insurance. Since when and who pays? Two parts of this question. That surprised me as well. So what I'll do is I'm going to find out if anything has changed and why it's changed, and we'll post that on a FAQ. And I'm fairly certain that if you've asked this question, we'll know where you've asked it from, and we'll try and get the answer straight back to you. So sorry, I don't know the answer to that, but I'll come back to you on that. And where do you do LGV medicals for license renewal? GP won't. You don't at the moment. So the DVLC have given a 1-year extension to all LGV drivers so that we can get over this period. Do you think it's time to follow other brigades and update the uniform for more practical form, i.e. polo shirts, and keep shirts for more formal duties? No, I really don't. So you'll know that we consulted earlier on, about the middle of last year, around uniform. Was it white shirts? Was it black shirts? Epaulets, open necks, closed necks, any other comment? And we got it very clearly back that it's black shirts with a black T-shirt. What I do know is that we've signed the clothing contract, or the clothing framework, so that we can get access to other things. So I do appreciate that it would be nice to have a lightweight type fleece, an anti-wicking fleece and an anti-wicking T-shirt, because these T-shirts are certainly not anti-wicking, they're anti-wicking. So we're looking at that, and we'll have access to that from September. But there will be other things on that framework, and we'll then look at our dress order at the same time. But we're not going to polo shirts. I have not seen very many fire and rescue services in the polo shirts, and the one I have seen, they don't look very good. They don't look at all professional. There's all sorts of issues with polo shirts. So I think the answer is quite clear on that one. With the projected numbers of staff retiring in the near future, with a number of these being watch commanders, are there plans to run a national watch commander recruitment process anytime soon? Yes, there is. And the People Organisational Development Directorate are looking at how we do this. Clearly, with a watch commander selection process, national one, there has to be some practical drills in it, and so we have to get within 2 meters. So that's being looked at, and I suspect it will run probably the back end of the summer, probably early autumn, but that's to be confirmed. I see in the COVID-19 FAQs online that it was asked if we could get access to Microsoft Teams. The answer was it was getting looked into, but not quite there yet. Any updates if this would be coming or not? So this is coming. One of the challenges we have with Microsoft Teams is that when you connect with Teams, it sets up a whole file grouping that actually we don't want to do. It provides, it groups the files of the people that are signed up within Teams, and that causes some logistical nightmares for ICT. So what they're doing is they're working in the background so that we can use Teams, but it doesn't do the file grouping, and that work's underway at the moment. As you'll appreciate, ICT have been fairly busy over the last 4 or 5 weeks, making sure that we can work from remote locations, making sure that the laptops are there and they've been built. In terms of the software build, that's been done, and now this is being looked at. So please bear with us as we look at this, and then we'll be moving across into Teams, because what we found is it's a much more stable platform than Skype, and it's a really easy one to use, and many people are now using Microsoft Teams. So we are going in that direction, not there just quite yet. When the time comes to return to the offices, how do you envisage this working? Some offices are too small to adhere to social distancing rules. Well, one of the conversations I've been having with the DEP today is what do we do about the new social distancing rules? Because they won't be here just for a very short period. I think they're going to be here for a very long time. And it's certainly something that the First Minister talked about yesterday. So I don't expect everyone to come back to the offices. There will be some people who will work from home and may come into the offices for a few days a week. I think we've adopted or adapted to a completely different working style that I'm very keen for us to continue to use, and a mix and match of what's worked best with some of the things that worked best from when we were office-based. So a combination. We're certainly not all going back to offices, and where we have small offices, one of the challenges will be around social distancing, which we will be adhering to. So you can see there's going to be some challenges. So we're making baby steps at the moment. It's one of the things that we're considering following the First Minister's announcement yesterday, and we'll work that through. I suspect we're a good few weeks away from anything like coming back to work just at the moment. Is there any scope for RDS drill nights being restarted by possibly only having 5 on station at a time? Enough people so a drill can take place and could run over 2 or 3 nights. Everyone gets the same training depending on the station establishment. I think it's a really good idea, and it's something that I touched on in the previous question that we'll be looking at, whether RDS units are split into 2 or 3 groups depending on the establishment. So we're going to provide that framework and then ask local officers through the LSO teams to make that determination, so that if someone displays COVID symptoms on one of the groups, it doesn't take out the whole of the station. A good question, and yes. Can I start by commending the way in which the services responded and adapted to the unprecedented situation we've found ourselves, express my gratitude to the uniformed and support staff, all working hard in challenging circumstances. I completely agree with you, and I really appreciate that, and everyone online has heard that. It has been an enormous effort, and I've been extremely proud of the way that we've responded to this as an organisation. So the second part of the question, I'd like to ask, based on the grim economic forecast about how COVID-19 could affect the economy, tax take and subsequent impact on public expenditure, how do you feel SFRS is positioned to absorb future budget cuts, and what the future for SFRS may look like as we come out of 10 years of austerity into a situation which will be financially even more challenging? Yes, so one of the conversations that I've been having with Sarah O'Donnell and also the sponsor unit in Scottish Government is what we think the impact may be on public sector finances over probably the next 5 years at least. And this is a personal opinion, so this is not born out of information I've received as the chief, but I've read the economic forecast as well, and thinking where the projections for COVID-19 are going to go, what could come on the back of COVID-19 over the next 2, 3, 5 years in terms of a corona type virus. There seems to have been a slight change, and it opened a door to this type of zoonosis, this type of transference. We had SARS-1 and SARS-2, then we had MERS, and now we have this type of coronavirus, COVID-19. It's not going to go away anytime soon. So we think that I think personally that the money will be invested as it should be in the front line in the NHS, in research, and making sure that we're in a much better place across the UK to respond to something like this in terms of vaccines and researching what's coming. So I'm expecting there to be flat cash settlements, maybe a budget cut over the next few years as money within Scottish Government is reprioritised. We're certainly looking at what does that look like as a fire and rescue service. I commissioned that work in April last year, looking at what does the whole of the risk map of Scotland look like. What does it look like now? And you've heard me say this in terms of the staff engagement around the broaden the role. And what does it look like now? And what does it look like over the next 10 to 20 years? And therefore, where should our resources be? We have a station footprint. We have an organisational footprint that's based on a pre-Second World War footprint. And we know we've got fire stations where there was industrial risk, where the industrial risk is no longer there. So we're looking at that, and we have been looking at that as part of what was the transformation programme for at least the last 3 years. So that work will inform how we respond to any budget challenges that we get coming for the next, I think, probably 5 years. And unfortunately, it is really quite a depressing view if you look at it in that way. But I think with the changes that we'll make in terms of our working practices and how we move into a slightly different place as working as an organisation, I think it also presents an opportunity. And as we develop that a little bit further, I'll spend some time talking to all of you as a workforce about where we see that. We're not in that place yet because we're still in a response and looking at recovery, but certainly I've turned my eye to that particular horizon now and thinking about how we work this through and what consultation needs to happen, how I engage you as a whole staff group, how you can share your ideas around what you think the service should look like, and we'll then see where we are probably the back end of the summer. So I appreciate that I've provided some answer to that, but as I think you can expect in terms of asking that question in that level of detail, there are some unanswered questions at the moment, and some questions we probably haven't asked that we should be asking, that we're working through as a strategic leadership team, and we will do with the board as well. Hi Chief, I see there are a number of brigades down in England and Wales helping assemble face masks for the NHS and social care workers. Are there any plans for us to get involved with this worthwhile project? Yes, there are. Thank you for reminding me, because I spoke to a station commander in London last week and got the details, and I had forgotten to go back to him because I was a bit busy earlier in the week. So I'm going to give that to my staff officer, give her the number so that we can make contact to see actually how we can get involved in that, because I think that's a brilliant way to get involved through a charity in making face masks for NHS and social care workers. So yes, I will, and then we'll find a way to communicate that and ask for volunteers. Is testing available for support staff? I have been unable to find details on how to register for testing. Please speak to your line manager, and all testing is available through HR. So they are coordinating it, and they did a great job coordinating it for me earlier in the week. How do I see things developing at restart of recruitment fitness testing? Whilst we understand the challenges presently, not all stations are able to maintain previous levels of cover. Recently, 4 staff retired and 1 to ring-fence duties to Scottish Ambulance Service. All those recently approached to return to are willing to do so. We've been informed temporary return of those volunteers is not possible. Are we considering how we can prioritise support to stations such as ours with specific staff issues? So I've just got an answer to a question I've already. So it depends. So the staff returning, it depends on how long they've been out. So that is being handled through HR and also ACO Paul Stewart. So I'll find out which specific station this is, and we'll provide a specific answer to your specific station. My view is that if people have recently retired, they can come back, because this is what we're doing for whole time. It should be no different for RDS. Liz Barnes is considering what we do around recruitment, because as you know, we can't do the breathing test, we can't do the spirometry. So actually that's a fairly significant part of what we do, making sure that people are fit to be able to wear breathing apparatus. And that one hasn't quite been bottomed out yet, because it's the same as everywhere else in the UK. So it's a specific answer to your specific station, which I'll pick up directly with you. I think I've provided enough of an answer to that. Can I ask if any support staff are at home having been furloughed? No, we have furloughed no staff whatsoever. So where staff are working, have got work to do, they're doing their own work. Where they've not got enough of their own work to do, then we're sharing out work across from other directorates that they can do. And where there's no work to share out, we're then encouraging staff to volunteer in their local areas with their local humanitarian centres and support the most vulnerable. So we're working really hard to make sure that everyone isn't sitting, no one's sitting at home. And as far as I'm aware, no one is sitting at home twiddling their thumbs. Everyone is doing something active and something to either contribute to our own response to COVID-19 or to support their local communities. And there's been some great stories coming through. But that's all the questions that I've been asked. So thank you very much for those questions. Hang on, one last question. No, one last question. That's great. So it's always great when you get an answer. You get question 14, and then the second one is answer to 21, which we haven't had a question 21. It's then correct. I've just been told to keep up. I'm doing my best. Someone else with thick fingers here as well. Okay, so the question, I'll get back to the question. Is there any plan? No, I've done that one. Will promotion holding pools be extended due to that we are not operating as business as usual? If we need to delay appointments, then yes, we will extend holding pools. As you know, we're out for a head of service delivery, DACO at the moment, and we're out for area commanders at the moment. And then once we've filled those posts, then we'll move down group commanders, station commanders, etc., all the way down to crew commander. So we're not at the moment. We're continuing as we know, as much as we can, as close to business as usual. And I've seen a number of fire services do instant command assessments via an online process, and I am absolutely certain that we can do that as well, because we have the technology and we have the skilled staff to enable that. So that is finally all the questions. That's great. Thank you for taking the time to dial in. Thank you for taking the time if you've done this on catch up. It's been really good to speak with you this afternoon. Please keep safe, please keep well, please look after yourselves, please look after your own mental health, your own emotional health, your own physical health. Please look after that of your family, your children, and please continue to do the great job that you're doing serving the communities of Scotland. I wish you a really good rest of the Friday afternoon and a fantastic weekend.